Hello and welcome to another edition of For the Record. I'm Sean Murphy. My guest today is a regular, and we love her. She's in every year. Nancy Lissay. She is the Director of Education and Training for Senior Resources Agency on Aging, and none of us are getting any younger. Welcome back to the show.
Thank you so much for your invitation. I really appreciate it. We have a lot of exciting things that we're going to talk about today.
Yep, a lot of new things, a lot of changes. I guess the first thing we could talk about is open enrollment. So that's going on not only for, the Affordable Care Act, but, for Medicare as well. It's open enrollment is happening right now.
Yes, it is. For Medicare, open enrollment started October 15th and will continue through December 7th. The important thing to remember is the new benefit that you're enrolling in or switching your plan will only start January 1st of 2017. So it's important folks know that they have their coverage for the end of the year. Even if they enroll in a different plan, it will only start January 1st.
And they should also know that if they do nothing, whatever your current plan is will just kind of roll over, and that could be a problem if, like, for example, the meds aren't covered, right?
Absolutely. I encourage anybody on a standalone Part D plan as well as a Medicare Advantage plan to have their meds, we call it screened. We do it free of charge for folks that are on Medicare, and we look at things, not just what's the cheapest plan for them, but we watch for prior authorization meds or quantity limits or step therapy, because oftentimes step therapy is a situation where you're required to use another drug in place of the one that has step therapy for 90 days and then use another one for another 90 days. And if that doesn't work, ask for an exception. However, it's not guaranteed the exception is going to be granted. So it's just a caution for folks. When we screen, we go on www.medicare.gov site. We need the correct spelling of the script, how many milligrams, and how many times an individual takes it. Because you may have a script that is a 30 pill count or 60 or 90 or 120. So it's good to get those meds checked. And because there are over 300 different formularies nationwide, we already know they're not all in Connecticut.
Right.
So this year, there's 21 standalone plans plus some Medicare Advantage plans. But what's interesting, Sean, is in 2006, when
10 years ago.
Medicare started covering prescription drugs, there were 66 plans to choose from in Connecticut. Here we're fast forwarding, as you said, 10 years, and now there's 21 standalone, and the Medicare Advantage plans brings it to maybe a total of 24 plans to choose from.
Is the reason cost?
The reason, I think, is profit.
Profit,
because if folks aren't making enough money, then they're taking their toys and going home.
Yeah, and that's kind of, to be honest with you, that's what they're doing with regular, the Affordable Care Act. There are so many that you hear in the news about them dropping out, leaving people with less options, right?
That's true, and that is also true of Medicare Advantage plans.
Right, the supplemental plans that you get in addition to Medicare to help cover the extra cost that Medicare doesn't, because Medicare is what, roughly 80%?
For Part B services, but you bring up an important point. If someone's on traditional Medicare, that's meaning Medicare is your primary, then the supplemental plans actually supplement the gaps of Medicare, which we'll talk about, and wherever you get treatment in the United States. Let's say you need a specialist in New York or Massachusetts. Not only is traditional Medicare going to pay, but so will your supplemental. However, folks need to know, even though they have a supplemental plan with traditional Medicare, they still need a Part D plan to cover their prescription drugs.
Right, D for drugs, and that's may not necessarily, you may not be at 100% on that, even at that point, even with the supplements.
Clearly, even with the supplement, it depends on which plan you get, but that only supplements Medicare Part A and Medicare Part B. The Part D plan just pays for prescription drugs, but not entirely.
You know, one of the things I see commercials like for Humana and stuff, and they emphasize it strictly for the drug part of it too. And you're right. You know, no matter how many insurances you have, suddenly you may realize I'm not covered for everything.
That's true. And a lot of the older population don't realize that there is extra help through the Social Security office. We help folks fill out an application called the Medicare Savings Program. And there's 3 levels of coverage within that program. Actually, we could do a whole show on that program, so
There's
I
so
won't
much,
get
yeah.
carried away.
You could do a whole program just talking about the Medicare A, B, D, all that stuff
Absolutely.
too. Yeah.
Absolutely. That's a good point. But we're not going to punish people by talking that. We're going to just talk about Medicare open enrollment. A lot of folks get confused on what do you do during open enrollment? Well, clearly, if you are a state of Connecticut retiree, you simply do nothing.
If this is your first time during your open enrollment, is it very different for you the first time as opposed to somebody kind of going through it again?
Yes, it is. Because the first time, you're not limited to just open enrollment dates.
Okay.
We call it the eligibility. Let's say you turn 65 in June, then you have a different window of opportunity for enrollment versus somebody that's already on Medicare, has been on Medicare, and now has Medicare as primary or has a Medicare Advantage plan. There's a number of things you can do.
So your first time, you become eligible when your age says you're eligible, but once
That's
you're on
correct.
it, then there's a specific eligibility open enrollment period for everybody.
That's correct.
Okay, gotcha.
And if you're Social Security disabled for 24 months, you may be eligible in a different month than open enrollment. But once that happens, then going forward, then you're in the open enrollment kind of mode. Folks can switch from traditional Medicare to an Advantage plan, or they can get out of the Advantage plan and go back to Medicare, or they can switch Advantage plans. However, you want to look at, are your prescription drugs covered, whether it's a standalone plan or a Medicare Advantage plan? Typically, Medicare Advantage plans are referred to as Part C because it's a marriage. You get your hospital coverage, your medical coverage, and your prescription drugs coverage from the one-stop shop. So that's how that goes. However, if you're in traditional Medicare, there are gaps that you have to be aware of. The Part A deductible for this year is $1,288. I'm sure that's going to go up in 2017. We have not been officially notified, so I am not going to throw out, I know it will go up, but I don't know how much. But that's one gap in Medicare.
Can I ask you to get more specific about the differences between the Medicare Advantage plan versus traditional? And why someone would want one versus the other?
The process is like walking from one room to another. The rules are all different. If you're in a Medicare Advantage plan, the plan's got to be certified in the county that you reside. So they're accredited by CMS, Centers for Medicare and Medicaid Services. However, they're certified by county, it poses a danger in some ways. Because I've been at Senior Resources for 28 years, I have seen managed care products leave the area. I'm sure.
And we're in a time where that's a realistic possibility, you know?
Well, if you look at managed care products such as PHS, HealthNet, they're not around anymore.
Yeah.
MD Health Plan. The idea is a managed care plan can leave your county, can leave your state with a 90-day notice to beneficiaries saying, we're leaving the state, these are your options. Either switch to another managed care plan or get a supplemental plan with prescription drug coverage that you're going to need with Part D. But when we talk about the marriage of Part C with Part A and B and prescription drugs, the issues are not only by county, but you're required to stay, if you're in an HMO, health maintenance organization, in a list of providers. And even if it's a preferred provider organization, it's just a nice way. If you go out of that network, you're going to pay more. So it's a nice way of staying. There will be more out-of-pocket costs if you don't stay in the network. So you want to make sure that not just your doctors and specialists, but hospitals.
Yeah.
You want to make sure that they're in the plan. Some hospitals typically didn't accept for a while some managed care advantage plans, Middlesex Hospital being one, and Bacchus being another. But to add to the complexity, you have, like United Healthcare has managed care plans as well as standalone plans, as well as supplemental plans. So talk about confusion.
And all you were doing was talking about the Medicare Advantage. You didn't even, now let's talk about how does that compare to the traditional? To me, right before you even describe it is, you may not have as many restrictions on the traditional Medicare, but you're only going to get like 80% of the cost covered, correct?
Well, if you have a supplemental with traditional Medicare,
Right.
you'll get the 20% covered
Right.
through the supplemental,
Right.
which is good. You have choice with traditional Medicare.
Okay.
As we talked about, you can go anywhere in the nation. Medicare is going to pay, so is your supplemental. When we look at that 80-20 business, that's Part B services.
Okay.
That's outpatient surgery. That is your doctors, lab techs, x-rays, ambulance services, things that you would use. Your preventive care services, that's all under Part B. Part A is strictly inpatient hospital stays where you are admitted.
Okay.
So if you hear the term you're being under observation, that is not Part A because you're not admitted. It's Part B. And if you don't have a supplemental, paying 20% of $100 is one thing.
Right.
Paying 20% of $10,000 if it's outpatient surgery is another issue for, folks on Medicare.
Someone who's a first timer, would they be recommended to start out with the one versus the other, traditional versus advantage, or does it really depend on the person?
It depends on the person
Okay.
because what we do is simply explain what the process is for Medicare as primary with a supplemental and a standalone plan. Some folks have retirement packages
Right.
that they don't want to compromise by enrolling in a Part D plan. Then that means they may lose some of their medical benefits. We don't want to do that.
Right.
So if somebody new comes to us and they're in that situation, we sell absolutely nothing.
Right.
Our job is to look out for the consumer. And when you look at the complexity, there's Medicare Part A, Part B, Part C, Part D. Then there's supplementals, A, B, C, D. People get confused, shocking, that I don't need this because I have Medicare Part A. They don't realize the supplemental is inherently different than Part A of Medicare.
I'm not going to lie to you. I'm confused right now. And so I am saying, thank goodness we have someone like you that can help us. Not me yet for a few years, but I thank goodness that someone like you will be there that can just explain all this stuff and have the paperwork in front of us and say, I would prefer it if someday you said, look, just sign here and I'll take it from there, all right? Can I have you give out a website for senior resources? We're going to take a break and come right back. Okay?
Absolutely. www.seniorresourcesec.org. And it looks a little difficult because the two R's
Yeah.
are together. And folks forget to put the EC for easternconnecticut.org.
We're going to put a graphic up on the screen for people to see, too. Nancy
Okay.
Lissay, Director of Education and Training, Senior Resources Agency on Aging. We will take a break and come right back. I'm Sean Murphy. This is For the Record. Stay right there. Welcome back to For the Record. I'm Sean Murphy. My guest is Nancy Lissay, Director of Education and Training for Senior Resources Agency on Aging. We sent people to the website when we went to the break,
Yes.
And we talked about how confusing things were. The website, is it easier for people to navigate through that and understand
It
things?
certainly is.
Yes.
It's user-friendly. There's a lot of information you can garner from our website. However, our website is not a real person.
Right.
It's a website.
And that's, if they come in, that's one of the things that we should emphasize. There are so many people. Sir, how big is your staff, by the way? And they're all professionally trained because things change so often, right?
They do change
Yeah.
often. And as I mentioned, it takes a village in this sense. Our whole staff is 21 individuals. Our choices trained staff is 5. We have a 56-town region, so you already know we can't be everywhere all the time. We have a core trained volunteers, a core of 70 people that are trained throughout our 56-town region. Some are located in libraries, some are located in senior centers, town halls. It's important because everybody has their own work history, has their own criteria, and if you're not versed in the nuances, you don't want to disenroll someone from an important piece. We mentioned earlier, state of Connecticut retirees. Well, they were sent a little envelope in the beginning saying, do not enroll in Part D because you will lose your medical benefits. Well, there's a lot of folks out there that are retiring from either Pfizer or EB or a number of other that have different components in their coverage. So sometimes it's not in their best interest for them to enroll in a Part D plan.
Interesting. Now, what would be their other option if they didn't enroll in the Part B, which is drugs, right?
Part D is
Yeah,
drugs,
yeah.
absolutely. Well, their options are to stick if they're a veteran, they want to
Good point.
keep that.
Right.
Or veterans are a unique population where they can have VA drug coverage,
Right.
but they can also have a Part D plan without compromising their benefits at all.
Can we talk a little bit more about veterans and their needs? First of all, we should mention, and you kind of did, it's such an individualized thing. Everybody that comes to you may need something a little different.
Absolutely.
And that's why we talked about your trained staff and everything. Let's talk about veterans and their needs and how you
Okay.
can help them a little bit.
We help veterans. A lot of times, some veterans get their care fully with the VA system, and they choose to do that. There's nothing wrong with that. We have other veterans that are entitled to Part A and to Part B that are enrolled in Part A and B. And some of them prefer a Part D plan, especially if they're in what I call the extra help, the Medicare Savings Program, because it will limit their copays to $3.20 for a generic or $8.25 if it's a brand name. Oftentimes, if they're on different tiers with the VA system, they're paying like $9 and $10 for their copay. The complexity lies with the getting together of the primary care physician, because a VA doctor cannot just order through the pharmacy a particular prescription. He's got to work with the primary care physician of the veteran. So that way, that doctor orders the meds, the veteran benefits, because now he can save that
Seems like a lot of red
copay.
tape, extra layers.
It's
and
bureaucracy.
Yeah.
It is. I didn't say it was easy, but I said we're committed to helping people. But it's individualized, and each person really should get their own individual screening. Just with the few screenings I've done since October 15th, there have been different individuals on a managed care plan that their prescription drugs that are covered for 2016 are not covered in 2017. So if you don't get that screening done, you get an annual notice of change. They send you a little thing saying, by the way, we're not going to cover this anymore. A lot of folks don't read their mail. It looks like more junk mail that they're being marketed to switch plans, so they toss it. And then, boy, come January 1st, they're in some trouble.
Does Medicare in general, does it follow the same, we've been hearing in the news about, the skyrocketing rates that are about to happen with the, Affordable Care Act. Is Medicare affected the same way? Medicare
is not affected the same way at this point.
Right.
Let's say that.
Yeah.
Folks that have been on Medicare for a number of years are paying $104.90 for Part B, which automatically disappears from their Social Security check unless they're on one of the programs for either extra help or the Medicare Savings Program will pay their Part B premium. Just the extra help that you get from the Social Security doesn't pay your Part B premium, just helps you with your prescription drugs.
Okay.
And what's interesting is the criteria is different, because if you went to the Social Security and enrolled in the extra help, the income and asset limit is income tested and asset tested. However, if you enroll in the Medicare Savings Program, then the asset test is waived, so you do not have to declare your assets, and the income guides are much, much more lax than the income tested at Social Security.
It seems like that's a popular thing, even with regular insurance. If you're not a senior, regular, that the health insurance savings plans seem to be very popular, and they seem to be emphasized more. And people do a good job of explaining it because it saves people money, right?
Absolutely.
Yeah.
I'm the favorite daughter now because I enrolled my mother in the Medicare savings. So now I supersede my registered nurse sister.
And basically, you can have in order to that will satisfy your deductible, right? If that gets filled up or gets.
If you're on the Medicare Savings
Right.
Program, yeah, you face no deductible, nor would you if you qualified through Social Security. But sometimes, and we say it's individualized, it's better for an individual if they meet the income and asset limit to go to the Social Security office, enroll, they get their benefit faster, but then we can fill out a Medicare Savings Program for them, and then they will get their Part B paid for. But new people coming on to Medicare are not paying the $104.90. They're paying $121.80. And that's, I'm sure, is going to change over time where the premiums become more and more, they increase because the cost of medical care increases.
Do you think, and I ask this from your point of view and what you do, looking down the road, is Medicare will it still be viable? Will it be around for a while?
I believe it will be.
Yeah.
I believe it will be in the sense of there's a lot of advocacy groups.
Right.
The older population to date has voted and has a voice, not just with advocacy groups like Aging Services, the National Council on Aging, the Center for Medicare Advocacy, but also through AARP, who's got a membership, who is the voice for the older American.
Do you encourage people to get involved with AARP? I mean, you're not. It's not your organization, but do you like it?
I am a member of
Okay.
AARP. However, when people come to me, I keep my opinions to myself. I will explain.
You'll give them the options, right?
Exactly. We have a rate sheet that we get from the Insurance Department of Connecticut. I show them the rate sheet, and we compare plans. Oftentimes, AARP in the supplemental world is cheaper because they can come in through group rates. But that's not always the case.
And they're not the only option either.
They're not the only option. There's
Right.
like 10 other providers.
Right.
If their premium is cheaper, I point that out because the plans are standardized. You're not going to get any more benefits
Okay.
if you pay a higher premium, which actually goes against most things. You get what you pay for.
Right.
Well, in this case, you could be paying $537 a month per person for a plan you can get for $220.
Yeah.
So that's my job to tell folks that because, as I mentioned, we sell nothing, but we want to make sure when folks leave our counseling site, whether it be the agency or another site, that they have the benefits that they've paid for, that they've worked for, that they're entitled to.
Okay, let me ask you another hypothetical. I ask you about the viability of the future of Medicare. How about for Social Security? Because that's the thing that people seem to be a little bit more concerned about.
Which really gets to me in a lot of ways because Social Security is a combination of what the employee and the employer pay in. That should not be subjected to the government dipping in there because of the national debt. And I'm very strong and very opinionated in that way, but that's my stand on that. Will it be around? Americans got to stand up for their benefits, advocate for the Social Security system, which should not be used. And I don't care who's running for president, that should be a question that is asked at every candidate forum. What is their stand on keeping Social Security safe and preserving Social Security?
So we are almost out of time. As we get ready to wrap it up here, what's the one thing you want people to know as we are now in Medicare's open enrollment period?
What I want folks to know is it is so much better for them to get a screening from folks that are not financially looking to enroll people in their plan, get a clearly unbiased reason, come to one of the choices trained people We have the choices information on our website, and go to a place, can be a senior center, but clearly go to something that they're not doing a program on that they want you to sign up for.
Yeah.
So do a fact finding. It's okay to go to a presentation, but get information and counseling for someone who does not have a financial interest in what you buy.
And by the way, if someone's watching the show today and might be from another part of the state, if they contact you, you can surely steer them to an organization that might be close to them, that might do what you do, and that can help them out, correct?
Absolutely. There's 169 towns in Connecticut. We serve 56. So if someone calls us from the Hartford area, we certainly would refer them to the Hartford Area Agency on Aging, or New Haven, the South Central. There's Western, Fairfield and Litchfield County. There's Southwestern. It takes 5 area agencies on aging to take care of the state of Connecticut.
Baby boomers are aging, right? Yeah.
Hey, I think it's something like 10 million people turn 65 a day in this.
We're going to put the graphic. We're going to put the website graphic up on the screen one more time. Nancy Lissay, Director of Education and Training for Senior Resources Agency on Aging. Always a pleasure having you on the show.
Thank you so much for the opportunity.
You make complicated things sound easy, or a little bit easier at least. So.
Well, I shared with you something that took me 28 years to learn.
Oh, and it only took us 24 minutes here. So that's our show for today. You can see this show on our YouTube site as well as many other shows. Until next time, I'm Sean Murphy. This is For the Record. Take care.